Okay, so you would definitely be knowing something about MRCS Part B. Okay, so primarily you're going to have two broad categories from which you have to take your preparation. One is knowledge
Yes.
part and other is the skills part. Okay, in
Okay.
knowledge part, you will be tested for the anatomy, for the critical care, and the surgical related pathology. And in the skill section, you will be tested for the examinations, procedures. There are like few procedures, but there is a broad syllabus for rest of the exam. And then you have the
Okay.
history taking,
Mm.
and then you have certain communication stations.
Okay, sir.
Okay, so in terms of the anatomy, you are going to be tested for the upper limb, lower limb, thorax,
Mm.
abdomen, pelvis, and head
Mm.
and neck.
Okay, sir.
Okay, like there will be complete anatomy. For
Okay,
anatomy,
sir.
primarily you need to have the knowledge to identify a certain thing. For example, you identify a nerve. Okay. First,
Mm.
they will ask you that identify that thing. Then they will ask you certain clinical relevant anatomy point that what is the nerve supply, like what muscles this nerve supply. If it gets damaged at point A, what will be the clinical picture? For example, it gets damaged at point B, then what will be the clinical implications? Okay, they will be clinically oriented questions. Then for terms of the critical care, there's a syllabus that involves the trauma section, and then there will be different scenarios, which could be from any pathology, any like surgical allied. So there could be abdomen associated critically ill patients, there could be urology associated scenarios, and there could be any other scenario, but the patient will be critically ill. So in the trauma, you will be following the ATLS protocol, but for these rest of the stations, you will be following the CCRIS protocol. Okay. Then comes the surgical
Okay, sir.
pathology. In surgical
What
pathology,
is a C crisp, sir?
yes. And for the surgical pathology, you will be tested
Mm.
for different cancers, their presentation, their staging, their treatment, and various other pathologies. Now, there will be
Okay.
three scenarios from anatomy, around two
Okay.
to three scenarios, I guess, from critical care, and two scenarios from the surgical pathology. Now,
Okay,
each
sir.
station will be 20 marks each. Okay.
Okay.
And you can be given 10 questions, you can be given 8 questions, you can be given 12 questions, but the total marks will be around 20. Okay.
20. Okay.
So
Okay.
it is very much easy to score maximum marks in anatomy.
In anatomy. Okay, sir.
Okay. So these
Okay, sir.
60 marks are your key. You should
Mm.
target to achieve that 60 mark. Okay. If you get
Can we
55,
get full marks also, sir, in
yes, yes.
stations?
If you
Okay,
answer
sir.
all the questions right, you can definitely get good marks. Okay.
Okay, sir. Okay, sir.
Because, like in critical care and surgical pathologies, there are certain gray areas. Some examiners,
Okay.
definitely the exam is very fair, but definitely there are certain gray areas. Okay, for example, they ask you about four indications. If you cannot recall those four indications, you will get only like half marks or 1 marks if it was a 2 mark question. Okay. So, like you can
Okay.
forget certain specific indications or specific management options or key things on the exam. But for anatomy,
Mm.
uh, like if they ask you to identify median nerve, the answer is median nerve. That's it. So there will be no
Okay, sir.
anything
Gray area,
ambiguity
like.
about that.
Okay,
Okay.
sir.
So
Mm.
similarly for surgical pathology, you can forget certain chemicals name, you can forget certain type of cancer, you can forget some points in their management, but for anatomy, you can score maximum marks. There is no doubt about that. Okay.
Okay, sir.
So that will be your go-to point. Okay. Now, then
Okay.
comes the examinations. You're going to have three examinations. stations, two procedures, two from the history, and two communication. Now, in the
Mm.
examination, uh, you will be having examinations from the cranial nerves in head and neck to ankle examination in orthopedic. Like there is complete body examination. Every examination could be tested. Okay. This includes
Okay, sir.
abdomen, uh, cardiology, respiratory system, CCRIS protocol, the varicose veins, appendix. Like there are lots and lots of examinations. Okay.
Okay, sir.
And similarly, there is a complete set of histories which accompanies abdomen, urology, orthopedics, and various other areas. Okay. Similarly, for
Mm.
communication, you are going to have two scenarios. One scenario will be with your colleague. Now, that colleague could either be an ITU registrar, could be your senior on call, or could be anyone like that. Okay. So
Okay.
the other communication will be with either there will be a patient or relative of that patient. It could be their brother, wife, mother, anybody. Okay.
Okay. Okay, sir. Communication.
Okay. Now each session will be around 9 minutes each,
Mm.
and there will be a bell at 6 minutes.
Okay, sir.
Okay. So there
Mm.
will be a bell at 6 minutes, and then there will be a bell at the ninth minute. Now, then they will
Okay,
give
sir.
you 1 minute to move from one station to the other station.
Okay, sir. These
One thing.
minutes will be calculated very perfectly, sir.
Yes, they will calculate it by themselves. Like you don't have to do that. Okay.
Okay,
Then
okay,
then
okay.
another thing.
So because will there be like more than a minute in while moving to the other station? So I'm asking like that. If
No,
there will be more time
they
or
make
will
sure.
it just go like that?
No, they make sure they have like lots of helpers to help you. So don't worry about.
Okay,
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 so
okay,
there is
sir.
another thing that there will be two circuits on the exam day.
Okay, sir.
On one end, this will be circuit one, this will be circuit two, and there will be a 30 to 40 minutes break. It can vary, but like rest of the things are permanent. Okay, so you will start
Okay,
from
sir.
station one, and this will be a room, and you will stand outside. Your face will be on this direction. When the bell will
Okay,
ring, then you will turn your face, and your 1 minute to read the scenario will start.
okay, sir.
Then you will enter. Then your 6 minute and 9 minute timers will be over there. Now, during this station, there will be a bell at 6 minutes. So if
Okay.
it is a knowledge based station, you don't have to
Uh,
worry. Okay.
okay, sir. Okay.
Because you will still
So
have,
the
yes,
so we'll take 1 minute to read the questions, sir.
yes. So there is
And yeah, sir. Yeah.
there is 1 minute to reach from station one to station two. Then there is one
Okay.
minute to reach the station outside the room, and then your 9 minute timer will start. So there is ample amount of time, and there are lots and lots of helpers to
Okay.
help you from one station to another. They will guide you. There will be arrows
Okay.
to guide you that okay, so if you have to go like this, there will be arrows, there will be helpers. They make sure of that. Okay, so don't worry.
Okay, sir. So 1 minute for reading that will not be included in the 9 minutes station time.
You will be given 1 minute to read the scenario outside. So
Yes.
this makes
Okay,
the
sir.
station as a 10-minute scenario. Okay.
Okay, sir. Okay.
So like there is complete 1 minute. In that 1 minute, if you have identified the scenario that okay, this is a easy one. I know this. I don't have to do the mental math before it. You can totally relax in that time period. Okay.
Okay, sir.
Okay. Now there will be random stations. There is no pet thing that there will be knowledge station and there will be skill station. You can
The
have,
stations will be random. Okay,
yes,
sir.
first station could be abdominal anatomy, next
Mm.
station could be history, and then next
Okay.
station could be pathology.
Okay, sir.
Okay, so that's the one thing that you have to practice and keep your
Okay,
mind
sir.
fresh on the exam day. Okay.
Okay, sir.
But there is one thing that there will be a clear demarcation. If pathology comes in your first round, then there will be two stations of pathology. And there
Okay.
will be three stations of anatomy if anatomy comes over here. And there will be two stations from another topic. Okay. So that,
I didn't understand that, sir.
okay. So let's explain it again. So for example, your
Yes.
first scenario is from anatomy
Okay.
and your second is from history. So in
Okay.
these 9 to 10 stations, they will complete three anatomy and two history stations. So that will make 5 stations. Okay. So
Okay.
the
They will
second
finish the
set
entire
counters the
category.
other part of the exam scenarios.
Okay.
And there will be one communication in section one and one communication in the other because all the rounds starts from a communication station.
Okay.
Okay. And there is another thing. Before the communication station, you will be given a complete 10-minute time to read the notes which are available.
Okay,
Okay.
sir.
So you will be provided with the case files, and in that station, you will be sitting alone with the case files. You will review them, you will make your notes, and then in the next room, you will have to either communicate with the relative or on a phone call with the consultant. It could be an IT registrar, it could be your on-call senior, or it could be anybody.
Okay, sir. So, for reading the case files, how many minutes, sir?
Like complete station, complete 9 minutes.
Complete 9 minutes. Okay. Then
Complete
only we
nine
are
minutes.
going to talk to the bystander.
Like these 9 minutes are inside the room. You will have 1 minute outside the room to read the scenario. Then you will go
Okay.
inside. You will have 9 minutes to complete your summary. And then again, you
Okay.
will have 1 minute outside the room of the consultant or that other colleague station, relative station. And then you will have 9 minutes to speak.
Okay.
Okay, so you have enough time to make your mind go through the notes, make your summary, and you can have like an expectations like what questions could be asked from that scenario.
Okay, sir.
Okay.
So totally, that 120 marks station will be like more than 10 or 15 minutes, I think, no, sir?
Yes.
Okay, okay, okay. Okay.
Okay. Then we have
Then,
the
okay, sir.
procedures. Now, in the
Okay.
procedures, there could be chest tube, there could be cannulation, there could be airway securing thing, or there are certain scenarios we will go through them. Now, in the history,
Okay, sir.
again, they have a lot of histories which we will be covering through. There is a scheme which is like having a 10-point scheme for the history, and there is a
Okay.
10 points scheme for the procedures, so that you can
Okay, sir.
score maximum things over there. Okay.
Okay, sir. So in the procedure skill, it will be on a dummy or real patient, sir?
Okay. So if you're asked to suture, you will be
Okay.
given a pad which will be on the
Okay.
knee or thigh of the patient. Like patient will be real, but you will
Okay.
not be.
It will be attached to the
Yes, they will
patient.
be attached to their tummy or their thigh or their upper arm. Okay, so they
Okay,
will be
okay,
attached
sir.
to it. For
Okay.
Foley's, the patient will be real, but there will be a
Okay.
simulation available. You will be doing the steps on it, and the patient will give you like the real scenario. Like he will tell you, "Oh, doctor, I'm having this stingy pain," when you will apply the lidocaine. So it will be like a real scenario to give you more stress. Okay,
Okay,
but it
okay,
will
okay.
be a
But we are going to
simulation.
do it in a simulator only.
Yes,
But
all
the patient will be sitting nearby.
yes.
He'll be
And similarly,
reacting to
for the
it.
examination, there will be an actor who will be giving you
Mm.
real findings or near to real findings. Okay.
Okay, okay,
And in the history again, they usually are doctors or some paramedical staffs, or like they give you really good history. They give you really good findings on the examination. So you like, we get confused. Okay, so he's looking normal, but why he's doing like this? Okay, so don't confuse with that. They will act like they are
okay,
real patients. Okay, and they are really good actors. They will give you positive findings, and you're not supposed to get confused on that. Similarly, for the communication, the patient or relative will give you. They can get angry at you. They
okay,
can shout at you. So you have to
okay,
manage accordingly. They will keep on
okay,
pressing you that you make a mistake, you like get under pressure. Okay, so I will guide you about a complete detail, like how to manage communication, how to manage history procedures, so don't worry about that.
okay, sir.
Okay, so let's
Okay,
create some space. Okay, so let's talk about anatomy in some detail. Okay,
okay, sir.
so for anatomy, uh Sala notes are really good. Okay.
Tala, okay, sir.
They have really good explanations. They have really good diagrams. Okay. So with
Okay.
Sala notes, you have certain options. You can use Sing notes.
Mm.
You can use Get through
Get
MRCS,
to MRCS. Okay,
and you
sir.
can use McMahon's Atlas or any other atlas which has good diagrams. There is some like Brain, Logan, Atlas as well. I will send you all these resources. Now, there is
Okay,
one
sir.
thing that these resources are there, but how to use them and in
Mm.
which order to use them is the real important key. Okay?
Okay, sir.
So you are not
Okay,
supposed to go through all of them. Keep
okay,
that in mind. So, like, there should be no regret in your mind that, oh, I forgot to get through MRCS, so I don't think so I can pass. So this should never come into your head. One thing.
okay,
Now
sir.
follow Sala notes completely. Do complete
Okay, sir.
anatomy from it. Upper limb, lower limb. It has great diagrams. It has really great explanations for all the relevant questions that can be asked. So
Okay,
once
sure.
you
So
have
I should do the Sala notes first.
Yes, these should be
Okay, sir.
done first. Now,
Okay, sir.
in Sala notes, the diagrams are from MacMan, so don't get worried about that. Okay.
Okay, okay, sir.
Plus, if you feel like the MacMan's Atlas is a bit overwhelming, don't worry. I will provide you with the folder which has all the necessary diagrams from MacMan's and various atlases. Even if you do that folder, you will be more
Mm.
than confident to do really good on your exam day.
Okay, sir.
Now, other thing.
Sir,
Yes.
one more thing, sir. Sir, I actually I feel like I've forgotten some things when I studied the MRCS part A. So EMRCS and all, I feel like I've forgotten things. Now, when you were telling the radial nerve, if it get injured at this point, what will be the defect that you will get? So actually, I think I have forgotten things. So should I go back to EMRCS and do revision? Or should I go back to teach me anatomy, do the first revision for some 2 or 3 weeks, and then come back again to the actual part B subjects?
Okay, so there are two options. One option is that you do what you have just told me, that you go back and go to Teach Me Anatomy, which is an amazing resource, no doubt about that. And
Okay, sir.
second thing is that I provide you with the anatomy lectures. You listen to them, and you just
Okay,
don't
sir.
worry about anything else. Okay. So I
Okay,
will
sir.
categorically be providing you with the lectures, and
Okay, sir.
before that, I will I do have some other lectures which will give you an overview about anatomy. They will be
Okay, sir.
they will be different from these anatomy questions, but they will have the concepts. You will get your concepts revised in a week. So don't worry about that. Okay,
Okay,
so
sir.
once you have done the Sala notes, you
Yeah.
can use, like, these are the accessory things. Okay, just keep that in mind. These are accessory resources.
Okay, sir.
So
Okay,
once
sir.
you have done the Sala notes, then you have the options to go through the Sing notes. Now, Sing notes are just like the Omaima notes version. Okay, they will have the
Mhm.
question and there will be an answer. There will be no diagram, there will be no explanation, like just question and answer, question and answer. Okay,
Okay, sir.
so they are very good for your revision. Once you have gone through upper limb, lower limb, head and neck, and you are on
Okay, sir.
court or you're anywhere else, you don't want to go through the hefty details, you just open the Sing notes and you review your upper limb, lower limb, and just be happy for that day. Then
Okay, sir.
you have the Get Through MRCS. It's a
Mm.
very good resource. It has very good scenarios. Now, these scenarios are for those days when you have done other resources very well. Like they will
Okay, sir.
add information and they will give you more concept. Okay.
Okay, sir.
But I
Mm.
have tried to gather all the information and I have made that folder so that even if you go through that folder, there will be, I guess, very small details which will be left behind. I hope so. Okay. But definitely
Okay,
you are
sir.
more than welcome to go through the Get Through MRCS. It will be very like easy for you to go through it once you have done Sala notes. Okay. But if you
Okay,
try
sir.
to do it first, then it will become very difficult for you because you will not have the right concept to go through these Get Through MRCS.
Okay,
Okay.
sir. Okay. And also, I happened to see one more book that is Anatomy Vivas or something like that. It was Anatomy Vivas for IMRCS by Nick A. Aresti,
Uh,
uh,
I have not
Manoj
gone through from
Ramachandran.
any other resource, and I personally don't think so they are necessary. But again, if you
Okay.
find time after this, then you can definitely go through them. Okay?
Okay, sir. That also has the questions and answers like Get Through MRCS. Get Through MRCS has like around 55 questions, no, sir?
Yeah.
This is also similar to that, like it has categories like limbs and thorax, like that. Just because I didn't know what to start with, I just got this book from the library, Anatomy Vivas for the IMRC. So I just started reading the upper limb topic. Then I found like it's quite similar to Get Through MRCS when I opened the Get Through MRCS. So should I be doing that or is it optional, like completely optional?
Yes, it is completely optional and it is a necessary
Okay.
resource. First, do the Sala notes.
Okay,
I
sir.
would
Okay,
suggest
sir.
that. So, because
Okay,
you will
sir.
get a very good orientation from the Sala
Okay,
notes.
sir.
Okay.
Okay, sir.
And plus, I will be guiding you for each part because MRCS Part B has different sections, and each section has its own details and how to manage it. Okay. So I will
Okay,
be,
sir.
this is just a superficial orientation. So like there is a lots and lots of things which needs to be discussed for anatomy, for critical care, for pathology. I will be discussing those things with you. Don't worry about that. But like I want you to go step by step. So don't get confused with the resources. So I personally
Okay,
think
sir.
from a number of students with which I have worked that people get confused in choosing the resource. There are a number of resources available.
Yeah, sir. Yeah,
Okay.
yeah, sir.
So if
Yeah.
you choose that book which you are mentioning, along with Sala notes, it will definitely augment your concepts. No doubt about that. But do it first from Sala notes. They are
Yeah, of
really
course.
great. Okay. They will give you an
Okay.
idea how exam is going to ask you questions. Okay.
Okay, sir. Okay, sir.
Then definitely after that you can go through any other resource, and I would suggest you to go through any other resource because it will help you to further get a broader orientation about different scenarios, because definitely Sala notes is not like 100% your exam. Anatomy can come from anywhere, Like there is no complete anatomy in Salah notes, but it will give you an orientation on how to get through the exam.
Okay, sir.
Okay, then we have the critical care. Okay, now with the critical care, you will be tested for the trauma. You will be
Okay, sir.
tested for respiratory scenarios, scenarios with reference to abdomen, which will be emergency-based scenarios and non-emergency-based scenarios. There will be ortho-related scenarios. There will be urology or kidney-based scenarios.
Okay.
Now, in the ATLS, trauma scenarios, you will have to go through the ATLS. So you will be practicing how to say the ATLS protocol. Okay.
Okay,
In
sir.
the respiratory part, the important thing is
Okay.
C crisp protocol, the
Okay, sir.
sepsis 6 protocol, the
Okay.
news 2 score. Okay, you
Oh,
definitely would be knowing better about these things. Okay, so but the
secret.
thing is that how you speak them and how you vocalize them. Vocalization is the most important thing because candidates know their almost similar resources, but the important thing is that how much you vocalize those concepts. So that is going to be the key difference on the exam day. Okay, because
Okay, sir.
mostly uh, candidates do almost same resources. Okay, so
Okay,
with
sir.
your practice, how much you vocalize them, how much you are good with the sepsis 6 protocol, how much effectively you can speak the ATLS protocol, that will make the difference. Okay. So in the videos that I will provide you, I guess you have gone through some of the videos. I have focused or I have deliberately said those complete ATLS protocol things so that you can memorize them and vocalize them in the mocks. Okay. Now
Okay,
there is
sir.
one other thing. When I will
Not
take a mock,
sir.
it will be
Okay.
covering it will be covered from a lot of resources. Okay. So you might get a scenario from Get Through MRCS or the book which you are mentioned. Okay.
Okay,
So
sir.
don't worry about that. I will try to cover that in the mocks. Okay.
Okay,
Like
sir.
that is
Oh,
the purpose of this course, that I provide you with the things which saves your time and provide you with the value. So that you don't have to go through everything.
okay, sir.
Okay. Then we have the pathology.
Okay, sir.
Similarly, in the
And
pathology,
one more doubt, sir.
yes,
Should I read the ATLS book
no, no,
or no need, no, sir?
definitely no. You don't need to
Because
read
it's a
the
very
it.
big
You
book.
don't need to go through the secrets. You just have to speak it the way I will tell you in the videos. So don't worry
Mm.
about that.
The
You
Secrisp, there is a fifth edition now coming available, no, sir?
No, no, you don't have to go through that much detail. You just need to know the concepts so that you
Okay,
can
sir.
vocalize it. Okay.
Yeah, sure, sir. Sure.
Definitely, there are certain new definitions about the sepsis, septic shock, sepsis 6 protocol, and the management we give them on the basis of the parameters of lactate and various other things. So you can update your knowledge, but I don't think so. You really need to go through them. Like you can
Mm.
have the summary of the chapters for the
Okay,
ATLS, for the secrets, but you don't have to go through all of them. Okay. That
okay,
will
sir.
be very much difficult to cover at the end of the day.
Yeah, okay, sir.
Now, in this surgical pathology, similarly, you will be tested for certain scenarios, like there will be lung cancer from the respiratory scenarios, there could be
Okay,
carcinoid tumor, there could be IBD, there could be colon cancer, like there will be different scenarios from different sections. Okay.
okay, sir.
So I have provided you with the schedule in which what I have done is that I have quantified this critical care,
Okay,
pathology, and anatomy into broad categories. Okay.
okay,
So
sir.
for
Sir.
example, in the trauma section, we will be covering all the trauma related stuff. You will watch the videos and then you will go through the mock. In the mock, you will see that what are your mistakes and how you will improve them. Then we will have the respiratory, and then we have rest of the others. Okay, similarly for pathology, I have divided it into different sections. Now the thing you will see that there will be relevant questions among those topics which I have uh, collected under one chapter. Okay, so that will be very easy for you to go through, because in the Sala notes, they are like in a different sequence. If you
Okay.
go start with the trauma, then you go to the abdomen, then is a respiratory scenario, then there is some electrolyte based scenario, then there is pain scenario, then there is some fluid scenario, other things. So I have quantified them that there will be perioperative care scenarios. So when you do those scenarios, you will see that there is some sequence of questions. So that will ease up your studies, and that will help you with the repetition of questions. Okay.
Okay, sir.
So that is,
And
yes.
what about the surgical critical care by Kanani? That one, sir. I don't have to. Should I go through that?
I don't think so. You just go through the Sala notes first, and
Okay,
then
sir.
you can send me that in PDF, because I have not gone through the latest resource.
Because the PDF of that book is not available
Okay.
anywhere. I actually checked it, then I got it from the library. So I started reading it. It has some airway is a chapter, breathing, circulation. So A, B, C, D, E. All each one is a chapter, and assessment and management separately they have given in that. So there are also topics about carbon dioxide and oxygen balance, the Haldane effect, the Bohr effect, and everything is there in the book.
Uh, I think you don't need to go into that much detail. Okay.
Oh,
So because there will be certain questions, they will be not testing your deep concepts about the Bohr effect, or what is the effect of specific organism in causing implant infection, in what is the effect of hyponatremia, what is the pathophysiology behind it. They will be just testing you for the core concepts, which are
okay.
quite enough mentioned in the Sala notes. So I
Okay.
would advise you to go through Sala notes and go through the video lectures which I will be providing you. That will be very much enough for you.
Okay,
And
sir.
after that, if you feel so that you need to go through any other resource, you are more than welcome. But I hope your concepts and the requirement of the exam will be met with the video lectures and the mocks that you take. Okay, once you take the mock, I will tell you that, okay, this is your weak point. This question you have to improve, and this is how it is going to be. Okay, so don't worry about using too much resources. It will
Yeah, yeah.
confuse you, and you will, after 2 or 3 weeks, you will feel lost in your preparation, and that is very difficult to get back to on once you lost your track. Okay,
Yes, sir.
so in last session, we have the discussion about the knowledge part. Okay, so
Yeah.
today we will be talking in detail about the skills. Okay,
Okay.
so in skills we have the examinations, we have the history taking, we have the communication stations, and we have the procedures.
Mm.
So with respect to examinations, you will have 3 stations, and with history, you will have 2 stations, 2 for communication and 2 for procedures.
Procedures. Okay, sir.
Okay. So in the skill section, in that 9 minutes that you will be provided with, you will be having a 6 minute mark that a bell will ring at 6 minutes. Now, you
Okay.
are supposed to complete your examination by this 6 minute. You are supposed to complete your history by this 6 minute, and you're supposed to complete your procedure by this sixth minute. For the
Okay.
remaining time period, in the 3 minutes, you will be having the viva for the examination that you have performed, for the history that you have taken, and there will be some follow-up questions on the specific procedure that you have performed.
Okay, sir.
Okay.
Okay, sir.
So in the examinations, it starts from the cranial nerves, it has abdomen, it has respiratory system, it has orthopedic examinations, it has almost all the examinations. It includes thyroid, varicose veins, whether it be general surgery or whatever, all of them are included. So you should
Okay.
be following the steps, and then you should be able to make your diagnosis, and you will be tested for how to investigate and what will be your treatment plan.
Okay, sir.
Similarly, for the history, it has similar sections. It will be from the orthopedics, it could be from the abdomen, and it could be from urology, or there are certain other divisions as well.
Okay, sir.
Again, at the end of the history, you should have certain differentials. You should have your diagnosis. You will be tested for the investigations and what will be your treatment plan. So in communication, one will be with the patient or relative, and second will be with the consultant. Now, in the communication stations, prior to these stations, which will comprise 9 minutes. Now, in these 9 minutes, the 6 minute bell will ring, but it will not affect your speaking. Okay. So there will be a 6 minute bell because for if you are sitting in the communication station, for someone it will be an examination station. Okay.
Okay. Okay,
So
sir.
in the communication station, you should not be worried about the 6 minute bell.
Well, okay,
Okay,
sir.
so you will be continuing with your speaking with your consultant and the patient attendant. So to
Oh,
understand this, the idea is that the patient or relative is like we experience in our wards, what we experience on our OT lists. Okay, so this investigation is new. You have to arrange the blood, and you have to tell the patient that you have to take or stop certain medication. Like these are just our general day-to-day scenarios. Similarly, with the consultant, it's like on the ward round. Okay, like you have to present your case to the consultant. You have to tell your case on the on-call consultant on phone, or if you have to make some referral to some other hospital or other department's consultant, it's just like that.
okay, sir.
And in the procedures, you will again be given a 6 minute window to perform, and in the 3 minutes, you will be tested on some follow-up questions. Now, this will include suturing, this will include airway, this will
Okay.
include chest tube, and very importantly, Foley catheter. And then in this procedure, you could also be tested for the OT listing. Okay. So how you will be managing the patients on the OT list.
Okay, sir.
Okay. So,
Mm.
and in the now this is the one exception that in the OT list, there will be a complete Viva type of station. So in those 9 minutes, you will be having the discussion that, okay, I will put this patient first. These are my positive merits and these are my negative merits for this patient. Then for this, I will put him second because of this reason. And I will put this patient third because of this reason. So there will be reasoning and cross questioning for this OT listing.
Okay.
Okay.
Okay, sir.
So for examination, history, and communication, the best resource to use is to follow the Bazid notes.
Okay.
Okay. And a lot of practice. So that's the only key, that you practice it with anyone so that on the exam day it becomes very easy for you.
Okay, sir.
Similarly, for the procedures, you can follow Andrew Miller's. It's a good book. However, you can do it from Salah notes as well. So like you just have to follow the what you say, the steps. Now these
Oh,
are the literature resources. Then a very good resource are the YouTube channels from where you can check for the examination steps. They are very good. They are very helpful. And
Mm.
the one which I prefer is using the GK Medicos. Okay.
Wikimedia. Okay,
So
sir.
the GK Medicos is very good. It helps with the examinations and it helps with the procedures as well. Now, there
Okay,
are
sir.
certain others as well. It depends. Like if you think that you want to see some specific detailed video for abdomen or orthopedics or thyroid, you can go and do your research. But
Oh,
these are the things like Bazir notes for reading, GK notes for actually watching them visually, how each step is performed, and then do the practice for
okay,
examination, for history, and for procedures. So
okay.
for
So, sir,
communication,
one doubt.
yes.
In procedures like suturing an airway, what will be the kind of vivas I can expect?
Okay, in the suturing, you could be asked for the type of suture, the
Okay,
type of knots,
okay,
and what are the important prerequisites. Like the patient should be given antibiotic or not. It depends upon the type of wound, which will be given on the exam day. Like if it is a dirty wound, then you have to add the tetanus prophylaxis as well. So just these are like basic questions, not very difficult questions. Similarly, for the airway, what are the like steps? First of all, we go with the chin lift and jaw thrust. Then we go with the Gedal's airway. Then we have the ETT, and then we have the tracheostomy, and in between we have the cricothyroidotomy. Like you have to follow the steps. They can ask you that how to measure the size of the airway, like such questions which are very much basic and related to the concept, to the overall concept.
okay, sir.
Okay.
Okay, thank you.
So this is the overall summary of the knowledge and the skills part. Okay.
Okay, sir.
So how our system will work that I will give you a target. For example, we start with the critical care, and then I will tell you that you do the scenarios of the trauma section. Okay.
Mm.
Now, in the trauma section, you will review those, and then I will conduct the mock session. Now, in the mock, I will provide you with a scenario and ask you with the questions, and then you will learn that what are your strong points and what are your weak points where you have to work.
Okay, sir.
Okay, so this also include the videos which I am providing you with respect to each chapter. So the benefit of using these videos is very high here. Okay, so these are
Okay,
not just to give you an overview, they will be helpful in your revision. Okay, so it is very easy that we get through the syllabus in the very first attempt. But
okay,
when we do the revision, it becomes very difficult to go through the same concept over and over again because the syllabus is quite wide, because you have to cover complete anatomy and there are examinations, there is history, and you have to keep all of that at one place. So these videos will be very much helpful in your revision and in your mocks. So they will
okay,
help you in both.
okay,
Okay.
sir. Okay.
So any further questions that you have?
Um, sir, I have actually joined this on-site course in London on
Mm-hmm.
May 2nd and 3rd
Okay.
by, I think, Dr. Mayat. Boot camp, MRCS boot camp, sir.
Okay.
So I have not prepared anything, so there would be mock exams also there. So I don't know what to like revise for that. I was